And I'm joined now by Yolanda. Thank you for coming in today.
Thank you for having me. I'm excited to be here.
And I'm so interested in this. I really respect the fact that you're targeting the aging population and really helping them find stability in what can be an extremely challenging time for them.
Well, working with this population is my passion. This is
Mhm.
what I've done my entire career. So I'm excited to be able to serve the community in this way.
So when we hear DAP, it doesn't really tell us much in the name. So talk a little bit about what DAP is.
So DAP, the acronym, stands for Dignified Aging Project. And so the goal behind the organization is to create a system of support and services for the seniors in our community.
Mhm.
DAP Services and Resources is a nonprofit here in the Lansing area, and we provide supportive services, case management, care coordination, and housing support for the seniors in the community.
Because I know that people that were asking for your services and then all of a sudden maybe came into crisis because of housing. And so your focus shifted.
Yeah, so initially when we started the organization, we focused on case management. And so I'm a nurse. I've worked in the healthcare field for almost 20 years and specifically with the geriatric population. And so throughout the time, I was noticing that there was a break in our community when it came to supportive services, specifically for those that are underserved or may not have had as much access to healthcare or additional supports. And so we started DAP in order to meet that need.
Mhm.
The goal was to do case management in order to be a bridge to serve additional services for them. Throughout that journey, we began to get a ton of referrals for clients that were at risk for losing their housing or in between housing. And it was very difficult to focus on case management because they did not have housing. They didn't have the basic needs met. And so we started off trying to find support in the community to figure out, what organizations are available, how can we get them housed or at least stable until they get housed. And there wasn't any, so we created our own.
And because of that, out of that need, because people sometimes just need services in the moment. So you do have walk-in hours for people that want to come.
Yes, so we have walk-in hours every Tuesday and Thursday from 1 to 4. We are at the nonprofit hub on Green Lawn. So if walk-in hours, you can come in if you need help with benefits, filling out applications, calling your doctor. Sometimes people have anxiety around calling, their doctor or specialist, getting their medications refilled. Whatever support you need, you're more than welcome to just come in during
Mhm.
walk-in hours. You don't have to commit to anything or sign up. You can just come in and we'll do our best to support you.
Because sometimes even navigating a computer for the elderly population or the phone can be very challenging.
Yes, that is a huge challenge. And as a community, unfortunately, I don't know that we recognize how we're isolating this population with technology, even just the simple requirement to have an email for everything. Most of our seniors don't, or if they do have an email, they don't have readily access to it. And so that is one of the things that we do is help get them set up with an email, help get them set up for their supports and services, and keep track of their passwords and emails so they have access in the future.
Well, I have an 88-year-old father, and so I know that I kind of manage his care, right? But if someone doesn't have family or someone to help, this is such a necessary service, I think, for people, what you're doing.
Absolutely. And we actually call ourselves professional relatives. And so
That's
that is one of yeah, that is
beautiful.
one of the phrases that we use because that's what we become,
Hmm.
we have the ability to, because of healthcare, the healthcare foundation and background, we can, be the interpreter when it comes to, what is it that you're supposed to do. One of the things we find with case management, a lot of times our clients will go to the doctor and they come back from the doctor and it's like, hey, what did the doctor say? Oh, nothing.
Hmm.
Oh, okay, what do you got
Hmm.
to do next? I don't know. And
Hmm.
so they didn't really listen or pay
Hmm.
attention, or maybe
Hmm.
they were overwhelmed. And so our goal is to try to pull the pieces out of that appointment to see, okay, you need to go get this med filled, or you're supposed to go get your labs done, just to make sure they know what their next steps are and it's clear, and they have that support and the continuity in order to make sure that their healthcare is being managed.
Oh, so helpful, because many times when we're listening to doctors, we can kind of get stuck on one thing and then you don't hear the rest of it. So if
Correct.
you have someone in the room with you, or if there's notes in their portal, and that's what you navigate to for them.
Yes, we do that. And we also have something called a summary of care. So, for our clients that need that support prior to going to that doctor's appointment, we will send a summary of care to the doctor to explain what the client is going to be seen for, what we need from them. So that way the doctor knows and they're not held accountable for having to remember. And then we follow up after to see, okay, what happened? What is next? So that it just takes the pressure off of our seniors when they're in for that appointment, so they don't have to worry about remembering everything.
That's fantastic. Well, that's where the LPN, your degree,
Yes,
that really came in very
absolutely.
helpful. In our final moments, tell me one story. Maybe it's even the one that happened today with the walk-in that really resonated with you and said, yes, I'm supposed to be doing this.
Well, so even right before this, I went up to my office just to drop some things off, and today is walk-in hours. And so we had a client that had walked in with all of his belongings. And this is someone that is struggling with some chronic health issues, some pretty significant ones at that. And currently he is street homeless. And so immediately my mind shifts from preparing for this interview to solutions. What can we do to make sure he has the support that he needs in order to be able to get to the next step? And so while we worry about the long-term goals, we want to know what can we do immediately to give this person a sense of security and a sense of stability so they can focus on their health while we also focus on the long term. And so for me, that just reiterated, I'm supposed to be here. This is what I'm supposed to be doing.
Absolutely. And providing hope,
Yes,
right? Hope
absolutely.
in action.
Yes,
All right.
hope and action.
Thank you very much, Yolanda. Appreciate it.
Yes, thank you for having me. I appreciate it.